losing clients due to income for them, but helping them get the income back from the medical. And it's a win-win for everybody.
Welcome to the Dental Office Managers Community Podcast, where we talk about the issues that matter most and help us to become better leaders in our dental practice. Let's dive right in. Hey guys, it's Kyle and welcome back to another episode of the Dental Office Managers Community Podcast. And today I am super excited because our conversation today is one of the most interesting topics and sounds intimidating to most dental practices and office managers. But once you understand it, you will realize how much opportunity most practices are missing. Today, I'm joined by Christine Taxin. Christine, thank you so much for joining us today.
Oh, thank you for having me. I'm excited, Kyle. You know, we go back a long way. So let's reignite, you know?
Yeah, it's been many years. It's been a journey, and some of the members in our group may already know who you are, which is awesome, right? You're one of the most trusted voices in dental medical billing. And Christine, you work with practices all over the country for many years that I can recall, helping them navigate what can be billed and how it's billed correctly, and most importantly, this is the most important thing I've learned from you, is how to stop leaving money on the table that they've already earned. So, Christine, I love that you teach medical billing, and I'm really excited to dig into this with you today.
Well, thank you, Kyle, and I'm excited to share all this information. I love sharing, and I love helping offices achieve their goals. And I can tell you many office managers have made higher salaries due to the fact that they are doing this transfer of losing clients due to income for them, but helping them get the income back from the medical. And it's a win-win for everybody. The doctor, the office manager, the biller, and the patient. So that's why I want to pass it on. That's what's happened to me for the last 20-something years. The joy of patients being able to get help is amazing. But I also have office managers who raise their income because of it. So it's a win-win for everyone.
Yeah. And one of those office managers is actually myself. So I don't know if you recall this. I know you get a lot of attendees throughout the years, but I can recall back, and I don't remember the exact year, right? Because it's 20-something years in dental, and it's hard to recall every single conference I've attended. But you were speaking, I believe you spoke in Philadelphia. It was at I think it was an American Academy Perio meeting, and I attended one of your conferences that you spoke on medical billing. And the information I received, I was one of those office managers that went back to the dentist that I work for, and I said to him, I said, look, I learned all of this stuff. I want to get this going in the practice. And I was able to use that as leverage to help increase my pay. Don't tell the dentist.
But you know what? They're happy to do it. That's what I find. That they're happy to, listen, nobody's a winner if we don't work together.
Yes.
And I think it's a marvelous thing, and I'm so happy that you did get that.
Yeah. Well, thanks to you and your amazing wisdom that you shared. So Christine, let's start here, right?
Okay.
A lot of dental office managers or a lot of practices are not doing medical billing. They're just not doing it. And I wonder, and maybe you can shed some light on this, but why do so many dental offices think that medical billing isn't for them?
Because it is different than dental, but when you learn it, you really achieve such high goals. So I'll give you an example of what I always tell practices to start with. There's a couple of things that we're doing that we're charging patients for. A CBCT scan. We invested a huge amount of money to buy CBCT scans. And I worked with Cable Kerr for 8 years at all their educational meetings, and it blowed my mind that they're buying these machines and not billing for them or charging the patient cash. So, when you learn one small thing for income, you could still charge your fee. You do not have to be in network with every plan. That is a choice that you should be making. And I actually recommend in the beginning not to go in network. This allows you to charge the patient and let them know that you're going to try to maximize their benefits for them. That it's always we're going to try to maximize your benefits. It gives you the reason to get the extra information you need for medical billing, but it also allows you to start where it's not overwhelming. So that's one of them. The other big medical billing payment is bone grafts. Now, you yourself are in that type of practice.
Yep.
Bone grafts are not covered by dental in a lot of instances. Am I correct here in saying that?
Correct.
So they're $800 to $1,000 a bone graft, according to what you're using.
Yep.
Why are you not trying to get that reimbursed for the patient, which will help them then do the implants and the overdentures? Now, we still recommend that you try to bill everything, but it is according to the patient's medical history on what we could achieve in getting it. But we're getting paid for all-on-6s in cases where the patient has a systemic issue. Mm-hmm. And that is the difference. We've always told patients, this is what you need. But we've never told them how they got sick.
Yeah.
When you start to tell them this is affecting the entire body, because the infection in the oral cavity is actually spreading. And if they have a disease like diabetes, they can never, ever get that pH level down to a level where they don't end up with emergencies. So things have changed greatly in our society and in our dental. Dental is moving faster than medical.
Yeah.
Okay. Now, AI in x-rays, what a beautiful thing.
Mm-hmm.
You can see everything.
Yeah.
It's telling the patient, here's an area that you have calculus that needs to be removed. You don't even have to try to tell them what you need to do. They can see it.
Yep.
And so there's a lot of changes that we should be embracing that will improve your medical billing, like oral DNA saliva testing, chairside saliva testing. It just brings a great wealth. And I've seen $40,000 cases get covered. So,
that was my next question for you is, besides us getting in this video, which we briefly spoke about the changes with the dental billing for the new codes for 2026 and how a lot of them are medical. My question for you is, what are the average size cases of payment that we're seeing for like bone grafts and cases like that when doing medical?
We have different averages by different practices, of course, But what I could say is I have a lot of periodontal surgical practices that bill with us. And because I teach it, but we have a billing company, a medical billing company. So we see $60,000, $80,000 cases coming across our desks. Wow. And they're very happy if they get 50% of it because the patient's thrilled. And one of the things I tell offices if I am teaching them when I'm actually working with them is look through the cases that didn't get accepted. Look at those cases. They're always the big cases.
Yes.
And that's because of money issues. And when we can offer them help in this way, it's a beautiful thing.
Yeah. Yeah, I agree with you on that.
So, and of course you have to pre-authorize. So, you're not going to tell the patient, well, it's covered when you don't even know. You find out. But that would be the same as what we did with dentistry. But
Yeah.
once you pass that 1,500, or if you're depending on referrals from a GP, if you're using up the money, he's not happy with us,
Yeah. Yep.
you know? And
Yeah.
there's a lot of other work that could be done, like TMD, sleep apnea. I mean, the list goes on and
Yeah.
on and on. So it's not just limited to implants and bone grafts. We have doctors all over the country that are specializing. I have many practices right now, right in New Jersey, not far from you, that
Mhm.
are doing sleep apnea and TMD billing on children, because
Wow.
sleep apnea is a big cause for children, and they are being misdiagnosed with attention deficit when they really have sleep apnea, because the
Wow.
symptoms are different for children than adults.
Yeah.
And they're doing amazing.
Huh. Wow. Wow. Yeah, I mean, you touched on something important, and I just wanted to briefly bring this up, right? You touched on if you're receiving referrals from a GP, which most specialty practices are, right? You that practice is relying on the annual maximum of the dental, right?
Right.
They're relying on that. They want to use that for their exams, their cleanings, their x-rays, their checkups, their fillings, the restorative dentistry side. They want to be able to use that amount. Now, if you go ahead as a periodontal or oral surgery or specialty practice and you use up that amount, they're not going to be very happy with you. And I can attest to that because I've seen it firsthand. So this gives them, it sounds like this gives them another avenue to be able to get treatment covered through the medical side.
Absolutely. And one of the big things I want to just tell you, I mean, I worked just like you, just like the other office managers for years. The difference was I did work in medical at Mount Sinai. For years, I worked there. So I knew medical billing. And then I married a dentist. So then
Hmm.
I went into dental, right? And it's kind of funny because somebody asked me, how did I start? I started because of my own daughter
Hmm.
needing a huge amount of treatment, but because of medications. Because
Hmm.
her dad's a dentist. My kids grew up in the back of the office after school doing homework. And they got cleanings and treatment whenever. We didn't rely on insurance. We didn't need to. And it's funny how you learn certain things when you need to learn them.
Yeah.
But everybody has a family member or a friend that actually needs us more than the average day of patient. And trying to help them is an amazing feeling at the end of a day. Now, you know that already because you're working in that field already. So you
Right.
try to do whatever you can, whether it's payment arrangements or whatever, to make them feel like they can get it done.
Right.
But even with all that, medical billing is legal. I want to make sure everybody understands that because for some reason there's a lot of myths in the industry. And
Hmm.
not being able to bill medical was one of them. But there are laws now on the books. So
Hmm.
I want to just give you a brief thing. There's one law that a patient cannot be discriminated by an office if they ask you to bill medical
Hmm.
for them. Now, that helps us because when you do go into medical billing, they can't say you're not allowed to do it if
Hmm.
that's what the patient wants. And that doesn't mean it's going to get paid. It just means they know today more patients are being educated with information about systemic and all that. And they want to know, well, why isn't medical paying if
Yeah.
I have this? And the
Yeah.
second one is the federal government put a law in place that states that as long as a dentist's license is active in that state, he is allowed to bill medical if it's a
Huh.
medical necessity. So we have coverage.
Yeah.
It's not like we're breaking a law. I really, every meeting I teach, I show them the laws and I send them if anybody wants them. Kyle, they could go on the membership platform. I'd be happy to send them to you, whatever you do on
Yeah.
that. or whatever they want. But it's really amazing that so many people don't know this.
Yeah. Yep.
And we are legally able to do this. So
Huh. Yeah, Christine, that's great. And I think a lot of people are not aware, right? And that's kind of why we're doing this video to bring more awareness around medical billing and dental practices and how it works and how you shouldn't be scared of it, right? As a team member, an office manager, or even a dentist. And you should embrace it and want to bring this into your practice because it's not only helping your patients, but it's also going to help generate revenue for your practice, which ultimately 2026 is here. Um, Practices have goals. They have to, reach those goals and exceed those goals. And one of the best ways to do that is by adding medical billing to their practice.
yeah,
Now, with that being said, you had mentioned briefly a little bit before we jumped onto this webinar that there were some changes with the 2026 coding, CDT coding that's coming out. So could
yeah.
we kind of touch a little bit on that?
Yes, there are as we know, every year we get new dental codes. However, the ADA has started to make dental codes for procedures that are being billed to medical. So, for example, last year they put sleep apnea appliances in. But if you bill the dental, you're not going to get paid. They did it so that you would know that you could bill medical. That's really what they did. But you can't use that code. This year there's like 5 new dental codes that are coming out that you're mostly everybody's updated in their computer. But there are five or six of them that are only going to get paid by medical. So I think what I would challenge the office managers to do is take a look at all the new ones. And what I can do for you, if that's something that's helpful to everybody, Kyle, I can do a webinar for your group before the meeting and acclimate them to what the new codes are and which ones and why they would be billed to medical. If that's something that's interesting to your organization, I'd be happy to do that. But
Yeah,
we
yeah.
do so much teaching on so many topics, and we try to break them up. And I don't know if you know this, but I have a, certification through the AMA for any office manager that wants to move into medical billing, because in the medical world, you're certified, and that
Mm.
automatically gives you a higher salary.
Oh,
Where
wow.
dental never did certification.
Gotcha.
And
Yeah.
so I went right to the AMA. I have a written book on every topic we teach so that it's easier for the office manager to learn. Because if you try to learn everything at one time, it's
Mm.
too hard.
Yeah. Yeah.
So
It can become overwhelming.
right. The medical world is different than the dental world. And one of the best parts of the medical world, Kyle, is how they break it up. You have to know the systemic affects the whole body, but then we can start with different areas according to what your doctor is. If he's an endodontist, learn endo. If
Right.
he's a perio, let's learn the perio. So that you're going to achieve your goals faster
Yeah.
because you're
Yeah.
going to specialize.
Right. Right. Yeah. Yeah. I love this. So, Christine, a question for you, from a team standpoint, right? Um, Before practice even jumps into, oh, I want to do this medical billing, right? What systems or training, have to be in place before medical billing can actually be successful in their practice?
Okay. There are a couple of things. I try to use all products that are free to start with
Okay.
because what I find is if an office manager is doing 3 jobs already, this is a big turnover. So what I find is as I'm teaching a lot of office managers, they say, can't we use somebody to do it? So what I've done is I've made my billing company without a contract so that
Mm.
if they're learning and you're busy, we can help you bill it. However, I do teach you what you need to get. So, for instance, every office needs an MPI-2. The medical world does not pay on an individual NPI. That's the doctor, but you have to remember medical is an umbrella. That's how I describe it. And each spoke is a different part of medical. So exams, radiology, then you have perio, you have endo, you have all of these things. And we have to follow that umbrella. Not everybody has everything in their medical. I also teach them how to read a medical card so that you don't tell a patient with an HMO that you could bill for them. You
Mm,
can, but I never recommend starting out with that because it's a lot of work. So
got it.
I try to simplify the process. It's better to get one patient than 10 that you can't help. Does
Yeah.
that make sense?
Yeah,
And
definitely.
then there are free sites that you're able to use. And one of them, probably a lot of offices are using already, which is Availity.
Yeah.
Many dental plans don't even accept it unless it goes through Availity. Well, the same thing with medical. And some medical only wants it to go straight to them.
Mm,
So, and even some Medicare Advantage plans want it to go straight to them. And
gotcha.
this year, Medicare did change a few things. They're starting to add more and more dental for patients with certain illnesses. So every year I teach that change because the more we're into it, the more we're going to see Medicare, regular Medicare change.
Hmm.
And
Okay.
what I find, and I don't know if your office managers are aware of this, but Medicare Advantage is a medical insurance with a dental policy in it. That means
Mm,
you can use that medical insurance for other things.
huh. Interesting.
So you're
Interesting.
not even changing a card. You're already billing to that Humana.
Huh. Okay. Yeah, I mean, I appreciate you bringing awareness to this, right? Because there probably are a lot of office managers, I mean, including myself, right? That not are not aware of all these recent changes or just changes in general or just things that we should have been aware of because medical doesn't always come first of mind, right? We're always like, patient comes in, do you have dental insurance as the first question, right? And from there, it's just a systematic process, right? So, let me ask you, if a practice, if a practice that's listening right now, let's say for offices that are listening right now that may feel overwhelmed, right, with the idea of bringing medical billing into their dental practice, what's the first mindset? Because I think mindset is very important.
Yeah.
What is the first mindset shift that they need to make?
They have to get out of the dental thinking, dental insurance thinking. And that is not easy to do.
Yeah.
I mean, it's just not. But I'll give you an example of what I tell them. Let's take off your hat. When I'm doing a 2-day hands on program or you come to the meeting, we say, leave the hat you wear outside this door. Come in
Hmm.
like a brand new job. Now, we do teach dental because it's necessary when we need to teach it. But we focus on helping you understand that even dental has changed. Because if you're accepting a dental card, are you billing the 4 periodontal visits every year that now patients that have diabetes are allowed to get paid?
Mm,
90% of the practices aren't doing that.
yeah.
Did everybody know that the AMA went to the ADA and said, you have to change your medical history? So if
Huh.
you haven't downloaded the updated ADA medical history, you're not getting enough information, which isn't just about medical, it's about malpractice.
Mm,
So,
mm,
see, they're putting the laws in, but they're not helping us get there. And
yeah.
that's where, it's up to us to make sure we get there. Because even if you don't bill medical, You still have to protect yourself. And
Yeah.
the questions that are needed are not the same. We must know their medical history. We must know their medication. It's not a want or a patient saying, I don't, what do I need to give you this for? Because they never looked at dentists as a doctor. We need to start to say, we are doctors and we are physician assistants
Yeah.
because we're helping the patient understand this. Does that help just a little bit?
Yeah, yeah. I mean, it all makes sense, and it's all connected, right?
It's all connected.
It's all connected, and I get it. I mean, look, in the years that I've been in dental, and I'm sure a lot of office managers that are probably watching this might feel the same way. Medical billing is not spoken about enough. And like you mentioned earlier, were those big cases, right? Those big cases that patients said no, right? They said no because maybe it was too expensive and maybe the dental just didn't cover enough, right? And they had a $2,000 allowance or something like that. And what happens to that patient? Typically, the patient says no, and then you'd have no more like, options to offer that patient. I mean, you could offer
Right.
patient financing, but they already said no, right? So you can follow up with that patient. You can continuously reach out to that patient and say, "Hey, are you ready now? Are you ready now?" Right? But the reality is, if you can find an alternative route, such as medical billing, it's going to alleviate a lot of that stress and obviously get that patient the healthcare they need.
Right.
One of the things is that I've just learned listening from you is that, you know, um, the ADA can set a lot of regulations and they can create these standardization of codes and stuff like that. But there's no one really there like to guide us through the process. So, yeah, I mean, and that's where you come in, Christine, right? So with Christine, with your conference, the Medical Billing Conference that you are doing
Mhm.
in Orlando, you're going to be diving into, I assume, deeper, real examples, real workflows, and like providing more clarity so teams can implement these type of
Yes,
things in their practice.
absolutely. We have three medical billers teaching this year, not just me. I have one that does the introduction to medical,
Mm,
an introduction. And Kendra is a really amazing, she's a hygienist who became a medical biller. So even, we look at anybody who has the talent to give the audience the information needed, plus the camaraderie. Our speakers don't go sit in a speaker room. They're with us all day long. You can talk to them at breakfast, lunch, cocktail hour, whenever you want. Hire whoever you want if you want to learn more. I'm not the only one. And I have a girl that I taught when we opened up Detroit Medical Center, opened up a dental in-house dental practice. And why was that important? Because the doctors, the surgeons, would not operate on patients unless they had clearance from a dentist. And now what I'm teaching at that meeting is, what are the medical doctors looking at? What are they being taught? Well, they're being taught to look in the oral cavity, to look for lesions, to look for decay, to look for red, puffy, bleeding gums. Why do you think that is? Because
mm,
they now have to refer to us. Now, let's
mm.
not do what we did a couple of years ago. We allowed them to make a medical code for silver diamond fluoride. And why do you think that happened? Because we didn't get coverage on dental in a lot
Mm,
of instances, because adults weren't allowed to get paid. And so people just, when they say it's not covered, what do people say? They don't do it. They think that the insurance company is in charge of what you need.
right.
When the medical world actually added a medical code and are doing it in the medical offices because we did not challenge. We
Mm,
have to we have to keep up with this
yeah.
because we either have to grow in it or we're losing in it. Now, I
Yeah.
hate to tell everybody, but the dental codes are going down this year. You will see they are going down. The
Mm.
dental industry is not doing well in the insurances.
Wow.
So when I pay thousands of dollars every year to get educated, and I go to a meeting called the National Association of Dental Plan, and honestly, it was just so disappointing that they're lowering their fees again.
Yeah, yeah, that is disappointing. I mean, a lot of practices are struggling already as it is. I mean, I see a lot of the questions that come through the group, and besides, what you mentioned earlier on was about getting paid for CBCTs. That's a big one that comes through our group, and the fact that I mean, practices are dealing with denials. They're spending so much time on appeals. You
Yep.
have the AI that's now I know, there are AI companies that are, having the same technology that's being used in the practice. So it's almost like, the technology that is great to help educate your patient on, is also another side of it where it's being used on the insurance side, right? So you have to really make sure all your, like they say, ducks are in a row, right? You have to make sure
Yes.
your documentation is good. You need to make sure, and again, this really ties back to the medical billing side because I'm not too familiar with that side, right? My course I took was many years ago, and for me, it's like, hey, look, if you can learn more about medical billing, bill smarter, right? Support your doctor, protect the revenue of the practice, and ultimately maybe even get a raise out of this.
Hmm.
Why wouldn't you want to take advantage of that? I see a lot of the members in the group, again, they come through with a lot of questions and they're looking for info. But what if you're able to gain that info by attending the conference? It's called the Insurance Extravaganza. Is that correct?
Yes. And it
Okay.
is a revenue-based meeting. So a lot of our doctors come too. They bring their teams, a lot of them. I mean,
Yeah.
last year I had a doctor from Kentucky came with 8 people from his
Wow.
practice.
Wow.
I can't say the name of the DSO, but we work with a big DSO. They're
Mm.
coming. And it's not just us. DSOs are looking for it too. So they're growing into medical. I have 2 large DSO companies I work with. But what I could say for the audience today is don't be afraid. You learn dental, but the problem with dental was hand me down information. People like you and me, and even your office managers, looked for more information and
Yes.
relied on each other. And at that, when I started, there was no Facebook or
Yeah.
anything. In fact, I made Colleen laugh the other day because I said to her, "Well, I started in dentistry before there were dental codes,
Yeah. Yeah.
before insurance."
Wow.
So I mean, I was a baby. I was 16 when I started working in a dental office, around the corner, right? No
Yeah.
dental codes, a little card, everybody paid $5 and they went home happy.
Yeah.
But the fees were like 20, 30, you know. Now
Yeah.
there's nothing at 20 or 30.
Yeah.
And it's not easy for families, but I can tell you if you achieved office manager status and you're doing well and your doctor is happy with you, then moving in a new direction is always a benefit to you, him, and everybody you work with because you really need the team to change too. And an
Yes.
office manager that's smart and savvy, and I've seen it, Kyle, so many times, be achieved to get everybody on board so that everybody is on the same page. Then you have a beautiful thing. It's
Yeah.
beautiful. It's
Yeah.
really exciting to see. And that's why our extravaganza became well known. I only allow so many people. I don't look to be like 1,000, 2,000 people. I don't want to be that because then
Yeah.
I can't give them the attention they need and want, and neither can my speakers.
Yeah.
So we are, and you'll be surprised. The companies I work with, I've been working with these people forever. I mean, I'm
Yeah.
in the field forever. I
Yeah.
hate to say
Yeah.
that, but
Yeah.
it's
Yeah.
true.
And
So, you
I
know,
agree. I agree with you, Christine. You know, with I agree with you. I wanted to just touch on this, but I agree with you on the learning dynamic, right?
mhm.
Like, you know, you go to a huge conference and you know, you don't get that personal feel. You don't get that. You kind of just go to a big conference, you sit there, you hear some information, and then you try to bring it back to your practice, and it's very hard to get started. So I love that you have this like more boutique kind of feel where people are able to communicate with the speakers right throughout the event, and
Throughout the
maybe
seminar.
yeah throughout the seminar. Yeah, so I mean I love that, and I think that's very unique. And this is what your is this your seventh year or sixth
This
year or
is our
something like that?
seventh. I mean, we had to stop for 2 years for COVID,
Yeah.
but we went right back after that. And I tried to go to different states, but everybody seems to love it here in Florida in February. Um, Last year we were able to do the cocktail hour outside by the pool, so
Oh,
it's
nice.
not so horrible. I
No.
can't guarantee that, but
Yeah.
like today is a gorgeous day.
Yeah.
You know,
Yeah, I love Florida, especially right now, you know, where I am, the Northeast. I'm looking outside and it's all white, just
yeah,
snow and ice. So
yeah.
so Orlando
Well,
is a
yeah.
great
I
place to be
still
in
have
February.
two children, one in Jersey and one in New York, and it was 14 degrees, and they were so happy to come down to celebrate with us, but like you have to go back.
Yeah, yeah,
I
exactly.
didn't.
Yeah. Yeah, exactly, exactly.
I
Yeah.
didn't. I want to
Yeah.
live longer, so I'm staying in the warm weather.
Christine, listen. So, you know, I appreciate you coming on here today and spending the time with me and our audience.
Anytime.
Could you share a little bit as far as the dates of the event and you know
Yes.
what
Well,
it looks like?
I would tell you that we have an itinerary up online, so we can look at that, which is on www.dentalmedicalbilling.com.
Okay.
And if you look at events, just look at the events, then go down and click it because you'll see every speaker, you'll see every course that you could take. And, our recommendation is choose your courses that you want to take. And if you have another person with you, have them take the others.
Mm,
Handouts are given, PACE credits are given, CE credits are given to everybody. And what I tell the managers is yes, we need CE credits so that you can do your medical billing certificate.
yeah.
You know,
Awesome. Awesome. That's
credentialing.
awesome. That's
So
awesome.
gather them, even at other meetings, because I don't see why we're not treated the same way as the medical world. You can't work in medical
Yeah.
without learning. And
Yeah.
and it is a benefit to everyone. Even if you farm out the billing, you still have to learn about it, to talk
Yeah.
about it to the patient. And the
Yeah.
other thing I give you is soap notes are very, very important. And we know that doctors are, as I said when I taught at NYU, this is what I said. They used to give me a manual of notes. And I would say, this is too much information. Then I would teach them in the residency program. And I said to them one day with Dr. Studley, uh, hey guys, this is text messaging. This is not notes because they didn't write notes anymore. They text message.
Yeah.
So what I did was I made a set of questions that everybody in the office front desk, assistant, hygienist, and then doctor have to answer about that patient's treatment, and it actually converts them into a soap no.
Oh,
So
wow.
it's
That's
that
great.
makes your life so much easier
Yeah.
because medical coding depends on what the notes say.
Mm. It's all documentation.
So it's like a
So,
foolproof lesson.
so this is something that the attendees who attend,
Yes,
the
yes, they will
insurance
get
extravaganza, they're going to get that.
right
Okay.
because you can't make a template because patients are different.
Right.
You're not dealing just with a cavity anymore and a tooth number. You're
Yeah.
dealing with their whole body.
Right. Yeah. Interesting. Okay. All right. Well, listen, Christine, again, I want to thank you for your time. I want to thank you for your generosity. I know that you have given a discount on tickets for our community members. And so
Yep.
I do have that special code that you provided. And so I am going to share that here in this video at the very bottom. So all of our viewers right now, if you're interested in attending the insurance extravaganza in Orlando, Florida, February 27th and 28th of this year, I want
Mhm.
you to click that link below in the comment section, and I want you to sign up and register because I will be there, and I'm looking forward to seeing each and every one of you there. Christine, again, thank you so much for your time, sharing your knowledge, your wisdom. It's always great speaking with you. I had a good time here. And of course, every time we speak, I always feel like I learn a little bit more about medical billing, and I'm looking forward to seeing you in Orlando.
Well, thank you so much, Kyle. And I learned so much from you too. So there you go. Sharing is the best. The best.
Yes.
So
Okay. All
I
right,
look
guys.
forward to meeting everybody, and I want to thank you for hosting this.
Yes, yes, thank you. All right, guys. Well, guys, thank you for viewing today, and I appreciate you tuning in. Looking forward to seeing you guys on the next Dental Office Managers Community Podcast. Have a great week, and Happy New Year. Take care, guys. Bye.